Good morning, everybody. The topic given to me is 1 minute preceptor. Myself, Dr. Vishnu Vardan, Professor, Rabinayar Physiotherapy College, Dattamaga Institute of Medical Sciences. Healthcare providers face many challenges in the day-to-day pursuit of their careers, and those who choose to teach health professional students face the further challenge of efficiently and effectively providing teaching to these learners. Fortunately, tools and techniques have been developed to assist the preceptor. A tested and valuable approach is the 1 minute preceptor. The 1 minute preceptor was first introduced by Neher et al. In University of Washington, Seattle in the year 1992. This is the typical teaching encounter. Much of clinical teaching involves the learner interviewing and examining a patient and then presenting the information to the preceptor. This strategy is common both in the office and hospital setting. Studies have indicated that on average, these interactions has take approximately 10 minutes. The time is divided into several different activities. Much of the time is taken up by the presentation of the patient by the learner. Additional time is spent in questioning and clarifying the content of the presentation. As a result, only about 1 minute of the time is actually spent in discussion. This 1 minute preceptor approach allows the preceptor to take full advantage of the entire encounter in order to maximize the time available for teaching. The teaching encounter will still take longer than a minute, but the time spent is more efficiently used and the teaching effectiveness is optimized. Learning objectives of 1 minute preceptor. Efficient and effective clinical teaching tool teaches at the level of each learner, delivers one key learning point, learner identifies areas of improvement, guides learners to self-directed learning. These are the 5 skills, micro skills of 1 minute preceptor developed by Neher et al. Get a commitment, probe for supporting evidence, teach general rules, reinforce what was done right, correct mistakes. Let us see the steps one by one. Get a commitment. The learners will articulate his own diagnosis, probe for supporting evidence. The preceptor will evaluate learners' knowledge and reasoning, teach general rules. Preceptor emphasizes common take-home points, reinforce what was right. Preceptor provides reinforcing positive feedback, correct mistakes. Preceptor provides constructive feedback with specific recommendations for improvement. Macro skill 1. Get a commitment. After presenting the facts of a case to the preceptor, the learner either stops to wait for the preceptor response or asks for guidance on how to proceed. In either case, the learner does not offer an opinion on the data presented. If the preceptor recognizes the patient problem, the immediate response is to want to tell the learner the answer. Preceptor. Instead, the preceptor asks the learner to state what he thinks about the issue presented by the data. Issues may include coming up with more data, proposing a hypothesis or plan, developing a management plan, figuring out why the patient is non-compliant, deciding on whom to consult. Rational. Asking learner how the learner interprets the data is the first step in diagnosing the learner's needs. Without adequate information on the learner's knowledge, teaching might be misdirected and unhelpful. When encouraged to offer the suggestions, learners not only feel more of the responsibility for patient care, but enjoy a more collaborative role in the resolution of the problem. Examples: what do you think is going on with this patient? What other types of information do you feel are needed? What would you like to accomplish in this visit? What do you think the patient has been non-compliant? Microskill 2. Probe for supporting evidence. When discussing a case, the learner has committed himself on the problem presented and looks to the preceptor to either confirm the opinion or suggest an alternative. The preceptor may or may not agree with the opinion, and your instinct is to tell them outright what you think about the case. Preceptor. Before offering the preceptor opinion, ask the learner for the evidence that he feels supporting his opinion. A corollary approach is to ask what other choices were considered and what evidence supported or refuted those alternatives. Rational. Learners proceed with problem solving logically from their knowledge and database. Asking them to reveal the learner's thought process allows the preceptor to find out what they know and identify where there are gaps. Without this information, the preceptor may assume they know more or less than they do and risk targeting their instruction inefficiently. Examples. What were the range of findings that led to your conclusion? What else did you consider? What kept you from that choice? What are the key features of this case? What questions are arising in your mind? Microskill 3. Teach general rules. The preceptor have ascertained from what the learner revealed the case has teaching value. That is, the preceptor knows something about it which the learner needs or want to know. Preceptor provides general rules, concepts, or consideration and target the learner's level of understanding. A generalized teaching point can be phrased as, when this happens, do this. Rational. Instruction is both more memorable and more transferable if it is offered as a general rule or a guiding metaphor. Learners value approach that are stated as more standardized approach for a class of problems or as a key features of a particular diagnosis. Targeting instruction minimizes the risk of misjudging the learner's sophistication on the topic, resulting in either insulting or losing him and wasting time of both preceptor and learner. Examples: patients with urinary tract infection usually experience pain with urination, increased frequency and urgency, and they may have hematuria. The urine analysis should show bacteria and WBCs and may also have some RBCs. Microskill 4. Reinforce what was right. The learner has handled a situation in a very effective manner that resulted in helping the preceptor, patients, or other colleagues. He may or may not realize the action was effective and had positive impact on others. Preceptor. Take the first chance for the preceptor to comment on the specific good work and the effect it had. Rational. Some good actions are pure luck, others are more deliberate. In either case, skills in learners are not well established and therefore vulnerable. Unless reinforced, competencies may never be firmly established. Examples: your diagnosis of probable pneumonia was well supported by your history and physical examination. You clearly integrated the patient's history and your physical findings in making that assessment. Another example: your presentation was well organized. You had the chief complaint followed by a detailed history of present illness. You included appropriate additional medical history and medications and finished with a focused physical exam. Microskill 5. Correct mistakes. The learner's work had demonstrated mistakes, omissions, distortion, or misunderstandings that have or will have an impact on the patient's care, the team's function, or the learner's own effectiveness. Preceptor. As soon after the mistakes as possible, find an appropriate time and place to discuss what was wrong and how to avoid or correct the errors in the future. Allow the learner a chance to critique his performance first. Rational. Mistakes left unattended have a good chance of being repeated. By allowing the person the first chance to discuss what was wrong and what could be done differently in the future, the preceptor is in a better position to assess both their knowledge and standards. Example: you may be right, the child's symptoms are probably due to a viral upper respiratory infection, but you can't be sure it isn't otitis media unless you have examined the ears. Okay,
बिल्कुल
now let us see a role
This
play
is
on
the
1
case
minute
of a
preceptor
52-year-old
between
female.
me and my
She is
student.
residing in Burma and she is referred from orthopedy to our department with the chief complaints of pain or bilateral knee along with swell. She is experiencing this complaint since last 5 months. She had pain or bilateral knee which was gradually progressive in nature. On NPRS, she rated 8 by 10. On further assessment, it was found that there was grade 2 tenderness or bilateral knee joint line. There was genovalgum deformity along with raised Q angle. Spasm was present over the calf muscles. Range of motion was affected bilaterally. And strength was 4 by 5 on MRC grading. On X-ray AP view, it showed that there was narrowing of medial joint space, subchondral sclerosis and osteophytes. According to the Kellgren and Lawrence classification, patient is on grade 3, so is planned for bilateral total knee replacement orthoplasty. So patient is being started with pre-operative physiotherapy.
Okay, Nikita. What do you think? Why pre-operative physiotherapy is important for this patient?
Sir, pre-operative physiotherapy will help to gain early recovery by increasing the strength, as well as it will help to get better understanding of the patient and improve the compliance.
What would be your post-operative physiotherapy goals?
So the first post-operative goal will be to reduce pain, to maintain range of motion and to increase the strength in the quadricep muscles and to reduce the compressive forces acting on the knee joint by various lifestyle modifications.
So pre-operatively, we should also focus on bone mineral density as patient has achieved menopause. This will help in designing the treatment protocol as per the severity of the disease. On the whole, your presentation was well organized. You included the X-ray findings with specific gradings. You treated appropriate palpatory findings. There are certain areas which needs improvement. You forgot to mention about the aggravating and relieving factors, diurnal variations, and special tests for osteoarthritis. So in conclusion, physiotherapy plays a role both pre-operatively and post-operatively. We should focus on quantitative progressive exercise and follow the adequate TKR protocol for better outcomes.